Good morning, good evening, good afternoon to those of us joining us from around the world. We're here to discuss the impact of the current crisis on resource-rich countries and why transparency matters. Up on your screens is the title of today's seminar. I do hope you're in the right seminar and you weren't expecting a different subject to be discussed. Just moving on to a couple of housekeeping rules very briefly. If Rachel can just change the slide over. We do want to let you know that the webinar is being recorded. We can also send out a recording afterwards. You will be on mute, but there will be an opportunity to pose any questions via the Q&A function. If you have any technical issues, please use the chat function and we'll try and resolve them with you. And with that, I will hand over to the EITI board chair, Helen Clark, who I think needs no introduction. Thank you very much, Helen.
Thank you, Joanne, and thank you to everyone who's joining us on the webinar. And thank you also to the panelists who've agreed to be part of it today. So I'm Helen Clark, I'm chair of the global board of the Extractive Industries Transparency Initiative. And this is our first virtual Transparency Matters webinar. The main focus for the discussion today is going to be on the impact of the COVID-19 pandemic on resource-rich countries. And there has been a strong response to the webinar with people registering from more than 50 countries. So thank you to all for taking the time to attend. Our panelists, we will be calling on, after I speak, Dr. David Nabarro. And David has just such an incredible bio in global health that we would take the rest of the webinar to talk about it, which we won't. But David, most relevant right now is you are acting as one of Dr. Tedros's, as Director General of WHO's special envoys on COVID-19. You're very, very close to the action or inaction, as it may be, in the comprehensive responses to the pandemic. Now, we had hoped to have one of our board members from Philippine Civil Society, Cielo Magno, joining us. She actually has called in sick. And Mark Robinson, our Executive Secretary of the EITI HQ Secretariat, he will be replacing Cielo, and he's going to talk about the impact of the pandemic on the extractive sector and on its governance. Then we're going to bring in the Executive Secretary of Nigeria's EITI, multi-stakeholder group, a very active group, and the Executive Secretary is Mr. Waziri Adia, and we look forward to hearing from him. The Permanent Secretary of the Ministry of Mines and Minerals of Zambia has just been called away to give a briefing on the sector, so he may be able to join us, but if not, I'll be moving right along to Roberto de Michele, who represents the Inter-American Development Bank and was previously Director of Policy Planning in the Anti-Corruption Office of Argentina. I should say we're very happy to have Argentina as a new member of the EITI. So that is our panel. Now, just some brief context from me. As we see it at EITI, a number of the resource-rich countries are facing a triple crisis. A crisis of fragile health systems trying to cope with the pandemic, and of course also they have the problem of falling revenue, and they have the problem of increasing expenditure as well to meet costs during the pandemic. So this is extremely serious for the resource-rich countries, and not only has the pandemic become a health crisis, it is a full-blown economic and social crisis. When your economy stalls, the revenues to government stalls, livelihood stalls, there are a wide range of economic and social consequences of that. Now, at EITI, we've had to adjust the way we work. Our multi-stakeholder groups have had to adjust the way they work to cope with lockdown periods and travel constraints and so on. But we do turn our minds to how we at EITI around the world can be helpful in these circumstances. We are an inclusive multi-stakeholder platform, and at the heart of what we do is to generate quality data which is made public about the extractive sector. And it is a large sector in the economies of many of our implementing countries. So understanding what is happening in this sector during the pandemic, transparency around the extractive sector and its governance is very critical to understanding what the way forward might be, or what lies ahead for the resource-rich countries. I should also say that when economies stall, when global trade and commerce stalls, when the demand for the old fossil fuel forms of energy drops, it does give us some early insights into what an abrupt energy transition might be like. And the energy transition is looming, but there is still time to plan for it. And that too requires good data for planning purposes. All the data that is generated through EITI is public data. It helps citizens to hold governments to account. It helps governments to plan, and it ensures, the aim is to ensure that revenues, which are a country's birthright, do come properly into treasuries and can be spent for the public good and not pocketed for private purposes. So that's what we exist to do. And that's the broader context of our discussion. So moving now to the first panelist, Dr. David Nabarro. And David, we're asking you to speak on the health outlook, in particular drawing attention to the demands that the pandemic is making on the budgets of developing countries, and perhaps also offer some reflections on the role of data in fighting the pandemic, as there are clear lessons in that for EITI and on the role of open data. So over to you, David.
Thank you very much indeed. Greetings to everybody. Because time is tight, I'm proposing to go straight into my observations and to work on about 10 minutes. If I go on too long, please catch my attention using the usual technique. Also setting the clock on my phone. Just want to start with a status update. What is actually happening around the world? Can I help you to make sense of what you're reading in the news and the like? And is this valuable? Sorry about that. So here is the situation. This virus is new. We've known about it internationally for 6 months. It's super easy to underestimate. It's a serious and dangerous virus. It's also advancing extremely rapidly across the world. Right now, it's particularly affecting poor countries in Latin America, Asia, and Africa. But it's also continuing to be extremely active in the United States, and in Western Europe. There's been a huge effort to get the levels of the virus down, but it's picking up with recurrences happening all over the region. And what I want to stress to everybody is this virus is not going away. We're going to have to learn as a world to live with it for the foreseeable future. And it's certainly going to be extremely unlikely that there will be an effective vaccine available for everybody in less than, I would say, 2.5 years, and probably considerably longer. So I want to just remind everybody, serious, ongoing problem. Now, I've said that the only way to deal with this is by people themselves being involved. And that's actually people being able to maintain physical distance of at least 1 meter, especially in confined, unventilated locations, being able to wear face protection, being able to be absent from work if they're sick, without too much in the way of questioning, and to be able to actually practice good personal hygiene. Now, we've seen that there are certain occupational settings that create a high risk of disease. They are, for example, meat factories or fish factories. They're also places where people are living together as migrant workers in very tight accommodation dormitories. And they're also very crammed environments like prisons or detention centers. And we're having to be very precise with people that if you really want to reduce the impact of this virus, attention to living and working conditions is absolutely key. And one of the problems is that the people who are most likely to be living and working in conditions that increase the risk of the spread of the virus are also tending to be poorest, people with the least to express their rights, and also the least opportunity for redress. So in meat processing plants throughout the world, we've been told that quite often the workers in these situations are unable to negotiate time off if they're sick, and so they tend to work through illness. And that may explain why there's been quite such a high level of disease and indeed death in these situations. I'm explaining this because I believe that this also applies in the extractive sector. In Poland, we have information that one of the big outbreaks that occurred in that country is among miners. We've got stories from other parts of the world where we're hearing that miners and those who are involved in extraction are more likely to get the disease because of the very close and confined circumstances under which they live. And we've also been told that often their remuneration is not in any way secured. So we'd like to stress to everybody, one, the virus isn't going to go away and it's dangerous. Two, that the only way to get on top of it is by having good quality community level public health services to identify people with the disease and to isolate them. And three, that it's absolutely essential that working conditions, particularly for poor people, are adapted so that they are not forced to operate under conditions that put themselves at risk. Now, last point, it is sometimes in the discourse, particularly in newspapers, that we are being offered a policy choice. Either the economy gets working again, or the nation focuses on public health. And the choice being presented to the public is something like, either we get the economy going and we save the jobs and reduce the suffering associated with poverty as a result of people not being able to work, or we follow the public health guidance and keep everybody in some degree of movement restriction and lockdown. But as we've seen, for example, in South Africa, it's an absolutely untenable trade-off to set up. You can't have a functioning economy if you don't have good quality community level public health services. And I think it's really important that employers start to speak out about this, whether they're in the extractive sector or any other sector. Employers certainly are telling me that they understand that without good quality public health, to be able to keep people safe, there is no real prospect of sustained reopening of the economy at the national level, and there's also very little prospect of creating the necessary corridors for trans-border movements of people, of goods, and indeed of commercial activity. And in the end, countries will find themselves once again being isolated. So it is absolutely essential to get the public health right for different aspects of the economy to recommence. So just now, ending with a couple of perhaps points that I think will come up in the discussion. Much of the removal of resources from the ground, in the case of resource-rich countries, also involves countries that have relatively limited cash available to invest in public health. So there is quite frequently a situation where the national public health capacity is itself quite limited. I found this in Niger, having worked there, and I've seen some of the trade-offs that have had to be put in place. I found this in Guinea during the Ebola outbreak, 2014, 2015. Also found it in Sierra Leone in Ebola times as well. And I found it in many other parts of the world, for example, in South Africa, where again, there have been issues around HIV and the extraction of resources and the involvement of certain communities in that work. I want to stress that as a public health professional, I think it is really important that collectively we understand that the need for good quality public health services that reflect some of the inequities in access to healthcare around the world has to be one that is put at the center of the business of the extractive industry sectors, and in addition, that is factored into the budgeting of the work of these extractors. It is going to put considerable additional costs in their way, but as we've seen with the food sector, as we've seen with the tourism sector, and as we've seen with the residential care sector, unless we start factoring in the true cost of employee health and well-being, it does make it very difficult indeed for us to explain the rationale for commodity pricing. And I believe that over the coming weeks and months, it will be necessary to recalibrate the pricing structure so that the necessary health services for those employed in these sectors are properly paid for. Thank you very much.
Thank you very much, David. Obviously the insights you've given into the impact on workers in confined spaces where the pandemic takes hold are extremely interesting. One thing I thought I might come back to you on immediately, accepting that a bungled public health response will mean longer and deeper economic damage to countries. There's also the case of a small country like my own, which got the public health response right, and people are now back going to football matches in the cinema and there's no community transmission. But we do have a sort of 1,200-mile moat around us called an ocean. And to what extent would you expect WHO, perhaps in conjunction with World Bank, and I'd also put this question to Roberto when we come to him, to be offering some advice to countries on safe reopening? Because once you've got to no community transmission, you don't want it back. But that can be clearly quite a dampener on economies becoming what they were. Any immediate thoughts on that?
Thank you very much indeed. It gives me a chance to really offer to the government and people of New Zealand incredible appreciation for the way in which you've set about dealing with COVID as a real example of the rest of the world. But of course, you do now have, as you've implied, a particular problem. You're down to zero or near zero. And of course, people coming back, as we've seen, whether it's coming from the UK or from other countries, are bringing the virus back, and you have to deal with it. So the answer is that every nation is going to have the capacity, to interrupt transmission and close down outbreaks. as a matter of course. But all nations have got the resources necessary to do so. It is resource heavy. We've seen even in your country that there's been some overload of capacity in dealing with the requirements of people coming in over the weekend. And there are many other countries with much more complex borders than yours that don't have the capacity to do it. So WHO is very clear. Every nation is going to need this capacity. Otherwise, if they don't have it, they will end up being pariahs. They will end up not being able to participate in international commerce, education, or tourism and leisure. And what are we going to do about that? Answer, there will be an absolute need for a fund that can offer resources to poor countries so they can strengthen public health capacity, and it won't be cheap. If we look at South Africa, for example, the costs even of dealing with COVID right now are huge for a country that has very limited reserves. So my lobbying, together with obviously Dr. Tedros and others, is to the global institutions, the World Bank, the IMF, the regional development banks, saying, please recognize you're going to have to come up with good concessional finance, obviously to be conditional, to help countries build up their basic public health capacity. Otherwise, they just don't stand a chance of being able to participate in the global system. And that's where the extractive nations absolutely are going to need to get it right, because otherwise they will find, whether they like it or not, that doors are closed to their produce and to their people. John, was I audible or not? So I think
you were audible, David. I think Helen has just momentarily frozen.
Yeah. But sometimes it unfreezes automatically.
Absolutely, and I'm sure she's dealt with that situation before. It looks like participant, she's just logging off, and I'm sure she'll be back in a very short moment.
Hi there, I've reconnected. Hello, can you hear me now?
You're great. I mean, Helen, this issue of where is the money going to come from to help poor countries build up their public capacity to the level that is necessary for them to be part of the international community. This is acute. And you know from our more private dialogue that I'm really worried that there is insufficient global attention to this issue. And the quicker countries, the rich world focuses on this, the better.
Yeah, and I'd certainly be fascinated to hear some perspective from Roberto on that when we get to him. But suffice to say, I have, with Gordon Brown and many other former leaders, been part of formulating letters to the G20, which accounts for 85% of the world GDP, really pleading to countries to dig deep in mobilizing a strong response to the needs of low and middle income countries, emerging and developing economies, which are in significant trouble as the pandemic really bites. Mark, I think it's the time to bring you in now with your bird's eye view right across the EITI family on the impact that the pandemic is having and the implications for governance and the transparency that EITI stands for.
Thank you, Chair, and a pleasure to be with you today, and a pity that we can't be joined by our board member, Cyril Magno from the Philippines, who would have given you a detailed country perspective. Let me just share three sets of insights which could be relevant to our discussion. First of all, the crisis is, of course, having major negative impacts on the revenues of most countries around the world. Some of those impacts are greatest in economies that depend heavily for revenue from the export of oil, gas, and minerals. And it's something, of course, we are concerned with right at the core of our response to the crisis at the EITI. We do track the impacts on the revenues of EITI member countries. When we first did an analysis back in March, before the oil prices plummeted, we were finding that the impact on tax revenues was anything between 7 and 36% below the same time the previous year. If you then factor in the oil price plummeting and those countries that depend heavily on oil price revenues, the impact will be far greater. And we're right now working on updated figures to get a sense of how much that is likely to be. Overall revenues, not just tax revenues, are also impacted, but not quite to the same extent because there's still revenue from fees and royalties. The second point I want to make is about some of the governance risks that are associated with the crisis. Those of you who know the EITI will be aware that we have some incredible new commitments in the EITI standard that sets the rules and norms for countries and companies that are members of the EITI globally. The first of which is contract transparency. As of next January, all contracts signed by governments with companies will be in the public domain. It's an incredible transparency innovation. But of course, the speed with which the crisis is having its effect can actually be a temptation to cut corners and to not put all the information that would fulfill full contract transparency into public domain. So it's absolutely vital that contract information is made public and is accessible to citizens and decision makers to make sure there is a good deal and that countries are getting their fair share of resources, which in turn are fundamental to fund the sort of public health response that David Nabarro was talking about. A second risk is around commodity transparency. Companies which are doing reasonably well in the crisis are those who've been buying up and shipping oil and gas in particular from countries around the world for sale. Some have done quite well and are keen to find ways of reinvesting resources back. So the countries that they deal with are also benefiting from those transfers. And again, having full transparency on commodity trading is vital at this time of crisis so that countries may be tempted to make some very quick decisions about potential sources of sales, which could disadvantage them in terms of the revenues they'd otherwise be due. Again, essential for investment in the public health response. And a third factor to bring to your attention is a domestic factor. What happens to the revenues once they are generated in the countries in question? A number of EITI countries have legislative provisions in place that transfer a share of the resources from the national level to local governments. In some cases, that can be really quite significant, up to 50% of total revenues being used for that purpose. If there is a risk of revenues drying up significantly, that risk could be compounded as national governments prioritize issues of national concern over local concern. But of course, it's very often the local level response which is so critical in an effective public health response and in terms of keeping people safe at their place of work. So these are three governance risks that we are concerned with and track at the EITI. My third point is about what are we trying to do in response to those dimensions of the crisis that most directly affect resource-dependent countries. And I'll flag three things that we are doing to try and make a contribution. At the Secretariat here in Oslo, we are working very intensively with member countries to identify ways in which we can support them in responding to the crisis by helping generate the kind of data to inform real-time decisions by policymakers as they try and grapple with these really complex trade-offs and decisions they need to make about the effective use of revenues. A second one is our board approved more flexibility for implementing countries, the 53 countries that are part of the EITI, so that reporting no longer became a very major burden in terms of retrospective assessment of revenues earned and taxes paid, but actually is much more using data to inform real-time decisions about the use of revenues and expenditure priorities. And a third one is to support, where possible, countries where they've had to make choices about what to spend money on. And it can be very tough for countries which are having to make decisions on prioritizing a public health response and funding something like an EITI National Secretariat to continue its vital business. These are terrible trade-offs for countries. And where possible, we are trying to direct sources of support, encouraging the World Bank with its trust fund to top up grants it's been making, to encourage bilateral and multilateral donors to continue supporting the vital work of EITI countries to keep the momentum up and prevent the risk of coercion on major governance and transparency commitments. So in sum, that's some of the ways that we at the Secretariat are trying to help countries respond to this enormous crisis. Thank you, Chair.
Thanks very much, Mark, for a good update on the way in which EITI and its mechanisms are responding. And what better person to turn to then than Waziri Adio, Executive Secretary of the EITI in Nigeria. Nigeria, of course, a huge extractive sector, and will be for sure feeling the impact of what's happening in the economic consequences of the pandemic at the moment. So Waziri, let's bring you in to hear how EITI in Nigeria is seeing things and how it's managing to work in these times.
Thank you very much, Chair, and good morning, everyone. In terms of impact on government finances in Nigeria, is actually very massive, massive indeed. Government revenues overall is projected to shrink by 45%. The budget deficit is expected to increase to almost 50%. And also the GDP is expected to contract, and the projection ranges from 3.2%, that's the World Bank projection, to 4.4% by the National Bureau of Statistics in Nigeria. So, and if this happens, this will be the worst economic contraction in 4 decades. So this is really massive. But the government has responded very swiftly to the double whammy of falling oil prices, reduction in demand, and also reduction in our OPEC quota. So what has government done, to adjust to this very gloomy reality? The first is that the government has slashed the budget. Despite that, government has to bring on new things in terms of response to COVID-19. So the budget has been revised. The budget benchmark price has been reduced by 58%. The currency of the country has been devalued by 18%. Subsidy on petroleum products has been removed. Government has also put in an economic sustainable plan that is going to cost about $6.4 billion. And also, we have secured an IMF facility for $3.4 billion. And there's discussion to get some facility from World Bank for about $1.5 billion, and others. So government has responded well and also on time to these very, very swift, decline in revenues. The question to ask is that why is Nigeria this vulnerable? And why is it that most oil-dependent or mineral-dependent countries are vulnerable? In the case of Nigeria, 2 things at play. The first one is that Nigeria still depends on oil revenues for 50%, for at least 50% of total government revenues. So if there's a 40–50% reduction in half of your source of revenue, then that's a problem. And also Nigeria depends on oil. Oil accounts for at least 80% of exports. So foreign earnings, 80%, at least 80%, comes from oil revenue. Then when you also combine that with the fact that there's a very lean fiscal cover for this kind of period. We have 3 oil savings funds. The total amount in the 3 funds is $2.1 billion. And if you use all of that as a foundation for the 2020 budget, you cannot use all of that because there are some constraints there and there. But 7% of the revised 2020 budget. So that gives you a picture of how gloomy the situation is. So it's very commendable that government has taken all these steps, but at the same time, while these steps will help in limiting the economic and social impact of the pandemic and the fall in oil prices and the effect on public finances, and while it will help us to manage through the moment, it's very clear that we need to look beyond the moment. And that's where we're thinking about how to reconfigure how we approach some of these things. We need to interrogate why we're in crisis. And the major problem is the dependence. And we know that oil is a product whose price is very volatile. In actual fact, between 2008 and now, that's in a period of 12 years, we have had 3 major fall in oil prices. The first one is in 2008, 2009, during the subprime crisis that started in America and that became a global contagion. The second one was in 2014 to 2016, when because of increase in shale production, that also impacted price. And this last one, which is a combination of the COVID-19 and the price war between Saudi Arabia and Russia and all of that. So the fact of the matter is that we live in an environment that is very volatile. Volatility is a fact of life in the oil market, and we need to prepare for that. So this virus will come and go. Prices of oil will go up again, but volatility will return. Give it another 4 or 5 years. So on the basis of that, say yes, we need to talk about transparency. We need to talk about coping with the health emergency. We need to talk about how to fund the budget and how to limit the economic, the GDP contraction. But we also need to see how do we ensure that we are not always vulnerable anytime prices fall, which, as I said, is a fact of life. So yes, we can't talk about transparency enough. We can't talk about accountability enough. We focus on this very important issue around resource costs. Our countries are vulnerable because they are dependent on natural resources. So from our own side, while we're doing the normal work of generating data and all of that, we're also trying to focus the attention of policymakers on the need to save for the rainy day, or the need to further diversify the source of government revenues, and or the need to control, to correct the distortions and resource dependence, introduced into the economy. Focus on this issue. And crisis strata, it can be caused by anything, including a virus, as we're looking at now. And most of the causes are exogenous. They are things that happen in other countries. So you don't have control over this. The best bet that you have is to reduce your dependence. The best bet that you have is to make sure that you save enough to tie you over, slump in prices, which is very regular. So we're doing a policy brief, and we think this is something that other countries, as we're talking about transparency, we should also be talking about how do we limit the impact of resource dependence, and how do we address the issue of resource costs, Dutch disease, and those other things. I will stop here, for now. Thank you very much.
Thank you very much, Waziri. And I think your comments about the impact of Nigeria, we sit thinking just how dramatic this is. Really a lot for the government and people of Nigeria to deal with. But good to hear how EITI is playing its role at this time too. Let me just remind people who are listening that we are taking questions. So if you do have a question you would like to put to the panelists, that question and answer box is down there for you to respond to on that. But let me come now to Roberto de Michele from the Inter-American Development Bank. Roberto, you know that we have a lot of EITI members, resource-rich countries in Latin America and the Caribbean, and insights from you on what they're experiencing and how the work that we do to promote good governance and transparency can be, part of the contributions to supporting countries to plot a way forward. Your insights would be very, very useful to us. So over to you.
Thank you very much, and thank you for the invitation. It's great to see you at LIST through this means, and I hope sooner than later we can see each other again face to face, which is also very productive, as you know. We're very pleased to partner with EITI in Latin America and the Caribbean, and I think the people who spoke before me gave a very, very detailed analysis of what the situation is, and that applies also to our member countries in Latin America and the Caribbean. Let me just add a couple of things to what has been said. One is we have to be, I believe, careful with expectations. Many of the things we are asking for are not developed and implemented overnight in normal times, and these are not normal times. So when we talk about having information systems, when we talk about having accountability mechanisms, when we talk about having governance for any given sector, this doesn't happen overnight. It takes a while. That being said, however, it seems that for some countries, the crisis has opened up an opportunity to speed up some of these reforms. We're not seeing that across the board, but I think there is an urgency driven, especially by health sector expenditures, to keep a better understanding of where the resources are coming from and where the resources are going to. And a couple of things that we are seeing in our member countries that I would like to highlight to the audience today. One is that some of the topics that are very close to our interests and our hearts are still on top of the agenda. So Mark mentioned the idea of contract transparency. That is still very, very much on top of the agenda. The second one is another subject which is very important to EITI and also for the bank for fiscal and financial transparency reasons, which is the whole discussion about implementing beneficial ownership reforms. We have found under the current circumstances that this is important not just for fiscal purposes or for transparency in the extractive sector, it is indeed a public good. And countries that are moving ahead to implement this type of reforms, I believe, will have a better chance in understanding how their financial and economic flows go from one place to the other. And the last thing I would like to talk about and show the participants some good news is technology is coming handy, and we have seen and we are seeing some good examples in our region. You're probably aware that the bank has helped several member countries develop platforms, technological platforms to track revenues from the extractive sector or revenues in general and how that resources are being spent. 3.5 months ago, the government of Paraguay was about to pass legislation for the emergency, for the COVID-19 emergency. Very interesting piece of legislation because it's one of the few that I am aware of that includes a full chapter on transparency and integrity. A very simple chapter in the statute, but the chapter does something quite smart. First of all, it requires that the government set up a task force among different government agencies to be ready within 2 months to produce data on the resources being applied to the pandemic. And that data has to be produced electronically. So in a single stroke of a pen, they resolve the cooperation problem and they resolve the problem of using technology. And they ask the bank for assistance in doing that. I'm going to show you the result because I think it is interesting. It is built on an existing platform. Mark, if you can raise your thumb, it means you can see it. You can see it. Okay. This is in Spanish, of course, and but you can track all expenses that are related to the crisis, including donations. You can see donations here on the right-hand side. You can see every contract, and actually, if you go into database of contracts, you can see if a firm or an individual was hired by the government of Paraguay 4 years before the pandemic, up to 3 to 4 years before the pandemic. So you can see whether or not this is a new company or not. There are many ways, and you can see how the resources are being distributed in percent terms, in local currency. You can translate this into dollars because this was one of the questions. Many countries are taking new debt to pay for this investment, so those debts are many times in dollars or in a foreign currency. You can basically conduct as a citizen or as a journalist or an NGO, you can conduct 3 basic activities. You can engage with the government in asking for more information. You can go deep down into a specific type of expenditure and get a result on that, an indicator on that, or you can place an allegation of fraud or corruption here that goes directly to the Supreme Audit Institution. We work with open contracting, so you can see every contract here that is related to the pandemic. I don't know if we have 1 extra minute, but you can break this down for every minister that is connected to the expenditures of the pandemic. These are individual subsidies, so these are conditional cash transfers. The legislation in Paraguay allows you to track even the person receiving that subsidy. And you can see all type of donations, who is donating and who benefits from that donation. You can see those numbers. One of the parts I like the most about this platform is the contract. Let's see if this works. There you are. So you can write anything on the screen and it's going to pop up directly. And of course, all of this is based on data that you can download and organize the data any way you want. So this is something that was built in 8 weeks with the bank. Of course, the original version that was launched exactly 2 months ago on April 29 has very little to do with the one you're looking at now, because once the platform is launched, there's a lot of interaction with the public and there's a lot of feedback saying it can be improved this way or the other and so on and so forth. There are now 6 countries in our region following up on Paraguay: Argentina, Costa Rica, the Dominican Republic, Ecuador, and Peru are going to follow suit and try to produce a platform in a short period of time that allows for this kind of interaction. So the glass half full is that some countries are taking advantage of this. And actually what we are seeing is that necessity seems to be, again, the mother of invention. And therefore, countries are saying, okay, let's break down the silos. I'm not interested just in revenues from the extractive sector. I'm interested in where the money is coming from and following the money. And this is very important because another background issue on the comments my predecessors made is that governments are going to need not only money, they're going to need trust. And the way they can build trust with their citizens is they can show how they're spending the resources that they have. So thank you so much.
Thank you very much, Roberto. And I think you touched on themes which are very close to the heart of EITI about making information available and helping citizens know what's going on. We've had a very interesting question come in from Myanmar, drawing really on a range of the comments that have been made by the panelists. And the question goes, I'm curious to know about the sustainable plan and arrangements, especially for crisis time, since David Nabarro mentioned it will take time, maybe 2.5 years, to solve the problem COVID-19 virus by a vaccine, in order to conduct, I guess, our EITI meetings, release reports, get through the validation processes against the EITI standard. And then our questioner comes to the nub. He says, if I'm not wrong, corruption issues are rising around the world. And it's interesting how to handle this from the EITI platform. So who would like to have a go at that? Mark, I can see you're smiling. What would you like to come in on that with?
It's such a good question, and thanks very much to the question from Myanmar. Spot on. The three areas I spoke about are all areas of corruption risk. And we are being more explicit now of using instruments like having full contract transparency, building beneficial ownership registers that Roberto referred to, which show the ownership structures of companies, which in turn can share their own information about what they're paying in and what should be received by governments. All these instruments are vital in a struggle against corruption and to make sure that resources are maximized for public benefit and health investment in particular. And so it's at this juncture, the idea that there could be any risk of significant resources being diverted for public gain, for private gain, it is clearly a terrible prospect. So activities of the sort that we've described today, and the example we had heard from Roberto in Paraguay is right at the heart of what we're trying to do. Getting data about what's coming into government coffers, what's been spent and from what sources is exactly why open data matters so much to build public trust in government intentions.
Thank you, Mark. And really sort of building on from this general theme, we have a very interesting question from Brian in Uganda, who makes the point that Uganda is currently an aspirant to join EITI. But he says, during this period of the pandemic, the oil companies continue to engage the government of Uganda in negotiations, and communities seem to be right out of such discussions, not informed of what is happening. And he mentions a particular instance where land was acquired and cut-off dates were set. There's no clear information. So what best strategies can civil society and community use to compel government and oil companies to provide feedback and information to the public? I think, Waziri, you're an experienced operator in the multi-stakeholder group in Nigeria. What advice would you give to our friend coming in from Uganda here?
Well, thank you very much. I think as the process for joining EITI is going on, it's very important to ensure that the restaurant, that's talking about governments, companies, and civil society, that is mainstreamed into the operations of aspiring countries also. So since they are not a member yet, I think what they can do is more of engagement and advocacy to ensure that the communities and the larger civil society are part of the discussion about how the resources are being used and allocated.
Thank you. Maybe David, coming back to you, obviously a lot of hope is placed on a vaccine as a way out of this horrible situation. And, we see some fairly bold statements about drugs going to trial and sort of, I take it from your 2.5 years outlook that we really are managing through this for quite some time. There's not miraculously going to be a vaccine appear sometime early next year that's going to reach 7.5 billion people, right? This is not just round the corner, and everyone who's listening here and thinking about how their economies are being impacted by the pandemic, needs to factor in this longer, well, medium to longer term management issue now with the pandemic.
Yeah, I think it's great the way you put it. It could well be longer than 2.5 years. Remember that the world has been trying to develop a vaccine against the virus which causes AIDS for more than 25 years, and this has not yet appeared. So I'm saying to everybody, don't bank on a vaccine or a therapy that will somehow come along and save us. Instead, actually get on top of this virus and build into your operating practices ways of living with the virus. And then I add one extra rider, which is to say the companies that do this quickly and do it immediately are the companies that are actually going to be in a better position in the long term. Same applies to countries. The countries that have worked through what this means and incorporated it into their standards of practice for example, employees who are involved in extractive work, they will, in the long term, be in a better situation. Whereas those that try to kind of avoid it, I think will get into greater trouble. I know that makes me sound a bit of a misery person, but I honestly feel it's better to say it like I believe it is than to sugarcoat. You know,
yeah, I totally agree with you, and I think it's a reality check to hear that. We're, you know, starting to hear people talk about 18 months to 2 years, but, you know, 2.5 years, maybe longer. So we're living with this. And I think your message to the companies to be thinking about how to operate in the extractive sector in a way that is keeping employees safe. This is a very important message. The message to countries is, you know, think very carefully about how you resume your economic activity if you're not on top of the virus, and then to all our civil society participants, because that's such a lively part of the EITI family, also the role you play in ensuring that people are aware of the issues in the longer term outlook. I know we're coming up to closing time. David Nabarro may have to fade away quite soon, but Roberto, if I ask for a last word from you, is the Inter-American Development Bank getting the resources it needs to support the countries reaching out to you and the other IFIs at the moment? The letters to G20 leaders that I've been part of have very much echoed Kristalina Georgieva's a statement that $2.5 trillion is going to be needed to meet the needs of the emerging and developing countries to get through this. Looking at it from the IADB point of view, do you have a comment you'd like to make?
Yes, thank you. And actually, the bank reacted very quickly, redefined 2 new lending products for this crisis, 2 pilot projects, and they're only related to health expenditures and fiscal policy with conditionalities. And all of our resources for 2020 to every country has already been committed, dispersed, or in the process of being dispersed. And the other thing that the bank did is it allowed countries, every member countries, 26 of them, to redefine whatever outstanding resources they had in existing loans with the bank. So let's say they had an infrastructure loan for $500 million and they only had spent 30% of it, 70% what was left, or the amount that was left, they could redefine it under these 2 new pilots. So we kind of shipped the boat around very quickly, and everything is now committed. But let me give you one more perhaps somber note and one optimistic one. I recently published an article where I analyzed what happened with the resources in the last 20 years when there was a hurricane, a tsunami, or a disaster, or Katrina. And in every occasion, give and take some point here or there, 20% of the resources disappear, either because of corruption or inefficiency or something. No matter the country, no matter the type of crisis. Now we're facing that at a global level. So that is something that we should be concerned about. We should do everything we can to reduce that percentage, and technology can help. And the other thing I believe may be something of an opportunity is EITI is a champion of collective action. And maybe this is a good time to think about collective action beyond one sector and see if the private sector can reach out across borders. You are particularly fitted, given your experience, to show other sectors how to work under a collective action approach, because that is going to be much needed in the days to come.
Thank you, Roberto. And the information you provided about, in effect, repurposing the instruments and the loan capacity you have is extremely interesting. But you also rightly remind us that when there's big sums of money floating around to deal with crisis, that creates opportunities for those of malintent. And I think that again comes back to the importance of EITI as a promoter of transparency and making the links there. Joanne, I'm going to hand back to you as our host.
Thank you very much. Thank you very much, Chair. And it really falls to me to give a big thank you to you, Chair, and also to our participants who got up early, stayed up late at night to join us here. For my part, I found this to be an incredibly uplifting event for a Monday morning here on a bleak summer's day in the UK. I think we started in a very sobering note, hearing a very realistic outlook from David Nabarro, but very quickly were able to come to some really fantastic examples from Nigeria, from Paraguay, from the Latin America region, of countries looking beyond the crisis and setting up systems that really demonstrate how open data can build public trust and can be used to provide a more resilient framework for open governance. So thank you for very much to all participants. The final thing I would like to say on closing also, I would also like to thank all the attendees. We've had over 100 attendees on the line. Thank you for your great questions. Before we close, I just wanted to mention that now that Transparency Matters has gone virtual, we'd like to make a habit of it. So we'll be holding another seminar in September, where we'll be focusing on opportunities and challenges relating to resource-backed loans to governments and state-owned enterprises. So I think that will be a really excellent topic to continue the conversation where we left it off today. Thank you to the panelists, and thank you to all the participants from around the world. Have a great day and a great week ahead.
Thank you, everyone. Great seeing you, and be safe.
Thank you.
Thank you.
Thank you. Stay safe.
Thanks very much.
Bye-bye.
Bye.